What if I told you that a routine checkup could trigger surgery, stroke, or even cancer? Each year, millions of seniors over 70 head to clinics thinking, I'm just doing the right thing. But behind those routine scans and tests lies a truth no one talks about. According to JAMA Internal Medicine, up to 37% of medical tests in older adults lead to unnecessary treatments and lifelong side effects. Take Mr. Harold, 75, a retired bus driver with no major issues. After a bone density scan, his doctor put him on medication. Just 2 months later, he was in the ER with severe jaw pain, a rare reaction called jawbone necrosis. The scariest part? He may have never needed the meds at all. In this video, we'll uncover 5 health checkups you should avoid after 70. Backed by top journals like Neurology Today and the American Geriatric Society, we'll walk through what each test really means, and most importantly, what to do instead. This isn't about fear, it's about smarter, safer choices for your health. Let's get started. You deserve the full truth. Number 1, bone density scan, DEXA scan. It sounds harmless, right? A quick scan of your bones. No pain, no needles. You walk in, walk out, and supposedly. But here's the truth. No one tells seniors. After age 70, this test can quietly lead to a cascade of fear, medications, and even irreversible harm, all based on numbers that might not matter at all. A major study in the Journal of the American Geriatric Society followed over 1,200 women over 70. It found that bisphosphonates, the most common bone drugs, reduced fracture risk by 0.3% over 5 years. That's not even 1%. Yet the side effects? Far more serious. Let me tell you about Eleanor, a 74-year-old retired violinist from Oregon. She had never fallen, never broken a bone, and walked her dog every morning. During her routine checkup, her doctor recommended a DEXA scan, also known as a bone density test. Her scan showed osteopenia, a mild decrease in bone density that's common with age, not osteoporosis. Still, her doctor prescribed a bisphosphonate just in case. 3 months later, Eleanor developed burning reflux and a dull ache in her jaw. She tried to ignore it, but then came the shocking news. Her dentist suspected jaw necrosis, a rare but devastating side effect where the jawbone starts to deteriorate. She stopped playing the violin. She couldn't chew properly. Her energy dropped, all from a pill she didn't really need. How did this happen? The truth is, bone loss is a normal part of aging, like wrinkles or gray hair. By age 70, most seniors, especially women, will show some bone thinning. But that doesn't mean your bones are brittle or that you're going to fracture next week. Yet, the moment a scan shows lower density, many doctors rush to prescribe medication. These drugs are intended for high-risk patients, but in seniors, they're often given just in case. Here's the scary part. These medications don't just come with side effects like reflux and joint pain. They can cause esophageal irritation, spontaneous fractures, and yes, in rare cases, jawbone death. So what's the better path? Instead of relying on a scan that might scare you into treatment, consider this. Vitamin D, crucial for calcium absorption. Seniors often need supplements because we make less from sunlight with age. Calcium-rich foods, sardines, Greek yogurt, leafy greens, almonds, all help maintain bone strength naturally. Strength training, simple resistance band exercises or chair squats can improve bone density more than you think. Balance exercises, tai chi, yoga, or even walking on uneven ground helps prevent falls, the real cause of most fractures. When Eleanor stopped the medication, her doctor referred her to a functional health program. She began gentle strength exercises, took vitamin D, and added sardines and kale to her meals. 1 year later, she was back performing in her community orchestra. Her strength improved. No fractures, no pain. This isn't about ignoring bone health. It's about understanding the risk versus reward. A scan may give numbers, but your lifestyle gives you strength. So before you agree to a DEXA scan past age 70, especially if you've never fallen or had a fracture, ask one question. What happens next if the scan shows low bone density? If the answer is medication with serious side effects, pause. Rethink. Ask about alternatives, because your bones are only as strong as the choices you make each day. Number 2, brain MRI for mild memory loss. Have you ever forgotten a name, misplaced your glasses, or walked into a room and wondered why you were there? For most people over 70, these small memory slips are completely normal. But sadly, they're often treated like signs of something much worse. And that's where things can take a dangerous turn. Many doctors, wanting to rule out serious issues, quickly order a brain MRI. At first, it seems like a smart idea. A high-tech scan to detect dementia, stroke, or even tumors. But what they don't tell you is this. Most of the time, the scan doesn't give answers. It gives you anxiety. A 2021 study published in Neurology Today looked at over 3,000 seniors between 70 and 85 who had mild memory complaints. A shocking 97% of those with abnormal MRI results had no condition that could be treated. Worse, nearly 12% were sent for invasive procedures like spinal taps or brain biopsies just to investigate harmless white spots on the scan, which are usually caused by normal aging. Let me tell you the story of Mr. Howard, a 76-year-old retired school principal from Michigan. He loved crossword puzzles, gardening, and Sunday church service. But over the past year, he noticed he was forgetting people's names more often. He worried it might be the start of dementia. His doctor sent him for an MRI. The scan came back showing white matter changes. Those words terrified him. He looked them up online. All he saw were articles about strokes, Alzheimer's, brain atrophy. He panicked. He stopped driving. He withdrew from his social group. He even began writing letters to his grandchildren, just in case his memory disappeared. But here's what no one had told him. White matter changes are extremely common after age 70. In fact, most are simply due to years of normal blood flow changes in the brain. They don't mean you're sick, and they certainly don't mean you're on the path to dementia. When Mr. Howard finally met with a neurologist, they gave him a paper-based cognitive screening test, something that took just 15 minutes. His results? Normal for his age. No signs of dementia. No decline in critical thinking or daily function. He cried from relief. But that emotional damage, the fear, the isolation, the panic, that all came from a scan that was never needed in the first place. The truth is, unless you're experiencing sudden changes like seizures, confusion, or drastic personality shifts, an MRI rarely helps for mild memory issues. In fact, it may do more harm than good. So what should you do instead? Better first step? Take a simple cognitive test. It's low cost, non-invasive, and highly accurate for screening age-related memory changes. Many clinics offer it. Just ask. Hydration. Even mild dehydration can mimic memory loss. Seniors are especially vulnerable because our thirst signals get weaker as we age. Sleep. Deep sleep clears waste from the brain. Make sure you're getting at least 7 hours a night. Mental stimulation, brain games, conversation, learning new things, these keep the brain sharp. Just 20 minutes a day makes a difference. Community. Loneliness worsens memory. Social connection is like exercise for your brain. Mr. Howard now walks every morning with neighbors. He's back doing puzzles, teaching part-time, and finally back behind the wheel. His brain didn't need a scan, it needed support. And if you're worried about your memory, remember this. Your brain isn't broken. It might just be tired, dehydrated, or underused. Always ask your doctor, what happens next if this MRI finds something? If the answer includes, we're not sure, or leads to a biopsy, spinal tap, or weeks of panic, pause. Your peace of mind matters. Take care of your brain, but don't let fear of forgetting rob you of the life you still remember. Number 3. Cardiac stress test. You feel tired walking uphill, a little winded when carrying groceries. You tell your doctor. Next thing you know, you're strapped to a machine, walking on a treadmill, wires on your chest, stress test in progress. But here's the shocking truth. If you're over 70, that stress test may not help you. It might actually harm you. Cardiac stress tests are designed to detect blocked arteries by simulating exercise. They're often used when someone feels fatigue or mild chest discomfort. But what doctors don't always tell you is this. These tests can be wildly inaccurate in older adults. A major study published in JAMA Cardiology found that in seniors over 70, false positives from stress tests occur up to 40% of the time. That means the test shows a problem when there isn't one. And what happens next? More tests, angiograms, stents, even surgery. Procedures that come with real risks, but little to no benefit if there wasn't a true problem to begin with. Let me introduce you to Raymond, a 75-year-old retired postman from Ohio. He walked every day, stayed active, and enjoyed hiking short trails with his wife. But lately, he'd been feeling more tired going up hills. He mentioned it casually during a checkup. His doctor ordered a cardiac stress test, just to be safe. The test results came back inconclusive, so Raymond was referred for a cardiac catheterization, a procedure where a tube is inserted into the arteries to check for blockages. A mild narrowing was found. A stent was placed. That night, Raymond had a reaction to the contrast dye used in the procedure. His kidneys started shutting down. He spent 6 days in the hospital and felt weak for weeks. And guess what? His fatigue? It didn't change. Turns out his heart was fine. The real issue? He wasn't drinking enough water, just mild dehydration and skipped meals, nothing a stent could fix. Raymond's story isn't rare. In fact, JAMA Cardiology reported that more than half of stents placed after stress test referrals in seniors were unnecessary. The patients had no improvement in survival or daily function, but they did have more bleeding, longer hospital stays, and kidney complications, all from chasing a false alarm. So what can you do instead? Option 1. Resting EKG. A simple, safe, non-invasive test that looks at your heart's rhythm while you're sitting still. It's a great first step for mild symptoms. Option 2. Coronary calcium scan. This is a low-radiation imaging test that shows whether dangerous plaque is building up in your arteries. It's accurate, fast, and much less likely to lead to unnecessary procedures. Option 3. Lifestyle review. Are you hydrated? Eating enough? Sleeping well? Many seniors feel tired due to age-related muscle loss, low iron, or even medications, not blocked arteries. Here's what Raymond wishes he'd heard from his doctor. Are you short of breath when walking to the mailbox? Do you get chest pain doing light housework? Because unless you have classic heart symptoms like chest pain during activity or severe breathlessness when climbing stairs, a stress test might be more risk than reward. In most healthy seniors without those red flags, less is more. And if a doctor suggests a stress test, always ask, what's the next step if it's positive? What are the risks of the follow-up procedures? If the answers make you uncomfortable, pause. Your heart is important, but so is your peace of mind. Don't let fear push you into a test that your body doesn't need. Stay hydrated, stay informed, and always ask questions. If you found this helpful, hit like and share this video with someone over 70 who deserves to know the truth. Number 4. Colonoscopy after 75. It's the gold standard for colon cancer screening. But what if I told you that after 75, a colonoscopy could do more harm than good? Yes, really. While this test can be life-saving for those in their 50s or 60s, recent studies show that for seniors over 75, especially those without symptoms, the risks may outweigh the benefits. A massive study published in JAMA Internal Medicine followed over 1.3 million seniors who underwent colonoscopies. For every 2 lives saved, 20 people ended up with serious complications. That's a 10-to-1 risk-to-benefit ratio, and it's something few doctors fully explain. Let me tell you about Doris, a 73-year-old grandmother from Michigan. Doris was healthy. No bleeding, no digestive problems, no family history of colon cancer. She walked her dog every morning and ran a small cake shop with her daughter. But during her annual physical, a newly graduated doctor suggested a routine colonoscopy. Just to be safe, he said. Doris agreed. During the procedure, they removed a tiny polyp, but that night, Doris experienced sharp abdominal pain and fainted in her bathroom. She was rushed to the ER. The colonoscopy had caused a bowel perforation, a tear in the lining of her intestine. She spent 9 days in the hospital, unable to eat normally, and lost over 10 pounds. She never returned to her cake shop. Now, was the polyp cancerous? No. Was there any urgent reason to screen her? No. Was the risk explained in detail beforehand? Sadly, no. And Doris isn't alone. The risks of colonoscopy rise significantly with age. The bowel prep can cause dehydration, dizziness, or kidney problems. The sedation increases the risk of post-procedure confusion or memory decline in older adults. And the procedure itself can lead to bleeding, tearing, or heart rhythm issues. That same JAMA Internal Medicine study revealed something even more troubling. Many of the polyps removed in seniors over 75 were so slow-growing, they would never have turned into cancer. In some cases, removing them actually created more risk than leaving them alone. So what's the better path? The FIT test, also known as the fecal immunochemical test. This is an at-home stool test that checks for hidden blood in the stool, a possible early sign of colon cancer. No bowel prep, no sedation, no hospital visit, and still highly accurate. According to the U.S. Preventive Services Task Force, for healthy adults over 75, especially those without symptoms, the FIT test is often the safer, smarter choice. Even better, it can be done every year from the comfort of your home, with your doctor's guidance. Now, let's be clear. If you're experiencing symptoms like rectal bleeding, changes in bowel habits, sudden, unexplained weight loss, then yes, a targeted colonoscopy may be the right step, under medical supervision. But if you're over 75, symptom-free, and in reasonably good health, ask your doctor, is this test really necessary? Are there safer alternatives? Your time, your safety, and your quality of life matter. Too many older adults are pulled into the colonoscopy pipeline, not realizing they have a choice. Doris wishes she had paused, asked more questions, looked into alternatives. So today, we ask you to take that pause. Share this video with someone over 70 who needs to hear this. Comment below, have you ever had a test that felt unnecessary? Like this if you believe in safer screening for seniors. You have the right to protect your health without risking it. Number 5. Full-body CT scan. They sound futuristic, thorough, safe. But for older adults, full-body CT scans could silently be one of the most dangerous checkups of all. And the scariest part? Most people over 70 have no idea what they're walking into. A 2023 study published in JAMA Internal Medicine revealed something deeply unsettling. CT scans, especially full-body scans done without symptoms, may now contribute to up to 5% of all cancer cases in the United States. That puts them on par with alcohol as a cause of cancer. Let that sink in for a moment. The very scan meant to catch cancer early might actually cause it. Let me tell you about Marcus, an 80-year-old former martial arts instructor from Arizona. Marcus was strong, active, and proud of his healthy lifestyle. At a senior health fair, he was offered an executive full-body CT scan for $999, marketed as a way to catch hidden disease before it started. He thought, why not, just to be sure. The scan found a tiny lung nodule, only 3 millimeters long, the size of a grain of rice. It wasn't causing any symptoms, but just seeing it triggered a medical chain reaction. Marcus was referred to an oncologist, then a PET scan, then a needle biopsy. The result? Benign, completely harmless. But during the biopsy, part of his lung collapsed. A rare but serious complication. He was hospitalized for 5 days, then spent 2 months recovering, unable to walk far or sleep comfortably. And all of it for a checkup he didn't need. Sadly, this isn't rare. CT scans, especially full-body ones, expose your body to massive doses of radiation. Each scan delivers 10 to 20 millisieverts, which is equivalent to around 500 chest X-rays. Over time, this radiation accumulates in the body, and the older we get, the harder it is for our cells to recover. That's why unnecessary scans can increase your lifetime cancer risk, especially after 70. Dr. Rebecca Smith, a radiologist at Johns Hopkins, puts it clearly. CT scans are powerful diagnostic tools, but in asymptomatic seniors, full-body scans often do more harm than good. Why? Because these scans often find incidentalomas, small spots or cysts that look odd but are actually completely normal parts of aging. But once they're spotted, fear takes over. Doctors feel pressured to act. Patients spiral into anxiety, additional testing, and sometimes invasive procedures they never needed in the first place. So, what should you do instead? Only get scanned if you have real, concerning symptoms. We're talking about things like unexplained weight loss, persistent pain, blood in stool or urine, new swelling or lumps. If none of these are present, a full-body CT, just in case, may do more harm than skipping it. Instead, focus on lifestyle-based prevention. A healthy anti-inflammatory diet, gentle daily movement, regular visits with a trusted primary doctor, blood work and targeted screenings based on real symptoms, not fear. And if you're ever offered a full-body scan from a private clinic or health fair, ask, what would we do if something shows up? If the answer is vague, or if it might lead to further testing without clear benefit, walk away. Your health isn't about testing everything, it's about testing wisely. And sometimes, not testing at all is the best test of all. Have you or someone you love ever had a scan that led to complications or fear? Share your experience in the comments. It could help another senior avoid unnecessary harm. Like this video if you believe seniors deserve smarter, safer checkups. And please share it with someone over 70 who's being pushed into a test they're unsure about. Remember, listening to your body is often more powerful than scanning it. Before we wrap up, let me leave you with this. Medical tests can be powerful tools when used with purpose. But after 70, more testing doesn't always mean better care. In fact, sometimes it can lead to stress, side effects, or even surgeries that were never truly needed. And the scariest part? Most of these tests are recommended out of habit, not necessity. If you've watched this far, you already know. Knowledge is your greatest defense, not fear, not routine, not pressure. So, the next time your doctor suggests a scan, a scope, or a stress test, take a breath and ask this simple question. If this test finds something, what happens next? It's not being difficult, it's being smart, and it could save you from months or even years of unnecessary treatment. Let me ask you, have you or someone you love ever had a test that ended up doing more harm than good? How did it change the way you look at medical care today? Share your story in the comments. Your voice might be exactly what another senior needs to hear right now. If this video helped you feel more confident in your choices, give it a like. And share it with someone you care about, especially if they're over 70 and still think more tests always means more health. Together, we can age smarter, stronger, and with fewer regrets. Thanks for watching, and we'll see you in the next one.